Health information technology execution and use, exchanging patient data, benefits and rewards. Health information technology security and privacy. Rules, regulations, penalties, and recovery efforts. Introduction and overview. Healthcare organizations are entrusted with the most private information of their patients and employees. Security and privacy will continue to impact the healthcare data exchange. The following are several examples of where security and privacy regulations will be tested. The Department of Health and Human Services has set a goal for healthcare facilities by 2015 to transition from the use of paper, files and forms to the use of electronic health records. Each facility will need to ensure that all the security and privacy requirements are in place. It was created the Health Information Technology Regional Extension Centers, which will play a major role in implementing a nationwide system of health information networks. According to the DHACS, these centers need to ensure that hospitals comply with regulatory and legal requirements to protect the patient's health information. Industry experts estimate that the amount of health data stored online measures in terabytes and will substantially grow in the next couple of years. New vulnerabilities such as physician mobility, wireless networking, health information exchange, cloud computing, connectivity of data to personal home computers, connectivity, and lack of sophisticated controls will impact security and privacy. Let's discuss about health information technology. It's a common element of nearly every health reform proposal. Health information technology can decrease costs, improve health outcomes, be utilized in the coordination of care, and improve public health care services and follow-up. Electronic health information technologies and the rise of consumer-focused health management tools can improve the flow of information necessary for good health care, as well as help individuals take a greater role in improving their own health, that is. With the increased utilization of personal health records. Throughout the United States, providers and hospitals are taking great strides to digitize all patient information, which is in turn raises the concern about the security and privacy protection of medical information. With large volumes of data stored electronically, there is a greater potential for sophisticated malware attacks that target applications and/or cause personal identity theft. As the healthcare industry increasingly relies on technology as a means of storing and providing care, security needs to mean more than basic guidelines on a password or a set of shared policies and procedures. This growing reliance on technology exposes the healthcare industry to new threats that go beyond those that have traditionally been a concern to healthcare in the past decade. This lecture addresses the security and privacy regulations, laws and requirements, continuity of operation and disaster recovery, risk and mitigation steps in evaluating security and privacy, and helpful hints to consider in protecting organization functions in case of security and/or privacy breaches. Let's consider laws, rules, and acts impacting security, privacy, and electronic data transmission. There are several older laws and regulations that initially started the privacy and security scrutiny related to patient medical information. The originals are still in effect, but subsequent laws have been enacted to clarify and modernize the original rules. In addition, there are also well-established standards for controlling security. It was also recognized the challenges to the confidentiality of health information presented by the increasing complexity of the healthcare industry. By advances in the health information systems, technology and communications, and through required promulgation of standards for the privacy of individually identifiable health information. It is clear from all the discussions and written comments that legislators regard privacy as of paramount importance for most people and privacy in a healthcare setting particularly so. The challenge for the HIT specialist in that setting is to find ways of safeguarding it. Health Insurance Portability and Accountability Act. Privacy Regulations. This Act privacy rule establishes national standards to protect individuals' medical records and other personal health information and applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct healthcare transactions electronically. The rule requires safeguards to protect the privacy of information and sets limits and conditions on users and disclosure that may be made without patient authorization. The rule also gives patients rights over their health information, including rights to examine or obtain a copy of a health record and to request correlations. Privacy protections under this Act extend to every patient whose information is collected, used, linked to, or disclosed by covered entities. HIPAA imposes responsibilities on the entire workforce of a covered entity, including all employees and volunteers, in order to secure those rights. It imposes the following privacy-related requirements on healthcare organizations: develop and implement explicit written privacy policies and procedures and document its enforcement. Establish boundaries and limit purposes for disclosure. Establish security protections against deliberate misuse or disclose. Develop a system for consumer control that enables patients to see records, obtain a copy, and know who else has seen them. Meet obligations for public responsibility by balancing claims to privacy with use of information for important, socially useful purposes with appropriate protection. Develop and implement procedures for individuals to submit complaints and designate a privacy official to handle any complaints. Develop a training plan and train the workforce on the policies and procedures related to privacy with patient health information. States have many laws and regulations that address health information for privacy protection. In most cases, where state requirements are stricter, they remain in force, HIPAA, but if the state laws are less strict, HIPAA requirements prevail. HIPAA Notice of Privacy Practices. As of March 30, 2011, HIPAA requires that plan participants of employer-sponsored health plans receive a notice of privacy practice. The requirement applies to health plans such as medical, dental, vision, prescription drugs, Section 125 Health Flexible Spending Account, and health reimbursement arrangements. HIPAA required that an NPP be provided to health plan participants at the time the plan was first subject to the HIPAA privacy rule. It is required that a notice of the availability of the NPP be sent to plan participants at least once every 3 years. The reminder must tell participants how to obtain a copy of the NPP for the plan. The reminder or an actual NPP does not need to be sent to the plan participant's home. Plans can include the notice in other benefit materials sent to participants or distributed at work. Many insurance companies and employers include the NPP Notice of Privacy Practices with the plan's annual open enrollment materials. If the actual NPP is distributed more often than every 3 years, the notice requirement has been satisfied and a reminder does not need to be sent. If the employer's insurance carrier sent an NPP to plan participants, the employer is not required to send a separate notice. Most carriers provide an NPP annually to participants of fully insured health plans. An employer can distribute one NPP that covers all of their plans, subject to HIPAA. It is not necessary to create a separate NPP for every plan. However, to do this, the employer must draft an employer-specific notice that correctly refers to all employer-sponsored plans subject to HIPAA. The NPP specifies the patient's rights to the following. 1. Right to see and obtain a copy of their own health record. 2. Request corrections of errors or add information that had been omitted that the patient finds. 3. Receive an accounting of how their information has been used. 4. Request limits on access to and additional protections for particularly sensitive information. 5. Request confidential communications for particularly sensitive information. 6. Pursue the complaint with the DHS Office for Civil Rights if problems are not satisfactorily resolved. Right to receive an NPP of any health care provider, health care clearinghouse, or health plan. HIPAA requires no other documentation from the patient in order for information to be used or disclosed for basic functions, such as treatment and payment, or for a broad range of other core healthcare operations. Supplemental authorization. HIPAA does require that patients sign a supplemental authorization before information can be used for certain extra purposes, such as research or certain kinds of marketing and fundraising. HIPAA extends extra protections for especially sensitive information, such as psychotherapy notes, communicable diseases such as human immunodeficiency virus and acquired immunodeficiency syndrome, substance or alcohol abuse, mental health disorders, or other information categories. HIPAA Administrative Simplification Rule. The entire purpose of the HIPAA Administrative Simplification Rule was to simplify the electronic submission of claims and to decrease the associated costs with paying for health care services. HIPAA Administrative Simplification Regulations now include the following, which will be elaborated upon later in this lecture. Electronic healthcare transaction and code sets. Health information privacy. Unique identifiers for employers. Security requirements. Unique identifiers for providers. Enforcement procedures. Standards for electronic healthcare claims attachments. Unique identifier for health plans. And modifications to the HIPAA electronic transaction standards. For physical safeguards, controls must be in place to add or remove hardware and software from the network so that personal health data are not compromised and protection is in place to prevent inappropriate access. In addition, access to equipment containing health data should be controlled and monitored. Hardware and software access and proper workstation policies regarding access or visibility need to be established. Technical safeguards for controlling access to computer system and enabling data to be protected in transmission need to be established to prevent interception by anyone other than the intended recipient. This includes protecting information systems holding personal health data from intrusion and data that have not been compromised or erased in an unauthorized manner. Data corroboration needs to be put into place to include such items as message authentication, digital signatures, or double keying. Finally, cloud entities are responsible for authenticating entities with which they communicate, the entity who it claims to be. The safeguards might include password systems telephone verification, or callbacks. Business associated under HIPAA. HIPAA requires the use of business associate agreements to safeguard external party practices that will have some access to PHI. Because safeguarding patient information can apply to external vendors and internal tracking and monitoring practices may not always work, these separate agreements and procedures for external staff need to be put into place. A business associate is a person or entity that is employed by, is exposed to, performs certain functions or activities that involve the use or disclosure of PHI on behalf of, or provides services to a covered entity. This can include medical data that are either in hard copy or electronic format of the medical record. Business associate functions and activities include claims processing or administration, data analysis, processing or administration, utilization review, quality assurance, billing, benefit management, practice management, and repricing. As of February 18, 2010, all business associates must abide by at least the following rules: comply with the HIPAA security rule, implement specific policies, procedures, and physical, administrative, and technical safeguards to protect medical data. Follow the HIPAA privacy rule, protect medical data from misuse, and follow the terms of new or existing business associate contracts. Train all employees on HIPAA and the business associate requirements. Train employees to provide the strongest protections to medical data. Provide breach notification. If medical data are compromised or lost, promptly notify medical entity, partners, and in some cases, patients if medical data in the business associate possession are compromised or lost. Administrative Simplification Compliance Act. The Administrative Simplification Compliance Act amended the HIPAA and required that all claims submitted to Medicare on October 16, 2003 and beyond be done so electronically, except for certain circumstances. International Organization for Standardization. The International Organization for Standardization, ISO, is the world's largest developer of standards. Although ISO's principal activity is the development of technical standards, ISO standards also have important economic and social repercussions. Medical organizations can easily adapt to ISO security practices. It is a comprehensive set of controls comprising best practices in information security. National Provider Identifier. The National Provider Identifier is a HIPAA administrative simplification standard that provides a unique identification for covered health care providers, all health plans, and health care clearinghouses. The NPI must be used in administrative and financial transactions adopted under HIPAA and with one identifying number. It will simplify security and allow greater protection or encryption of the provider number. The NPI can be used to identify the healthcare provider on prescriptions, COB between healthcare plans, inpatient medical record systems, program integrity files, and other areas. Depending on his/her practice, a provider can obtain an individual or group NPI. However, there are similar situations where an individual NPI number is required, such as with the submission of pharmacy and laboratory claims. The NPI remains with the provider regardless of job or location change. NPI will eventually be the standard identifier for all e-prescribing under Medicare Part D. The NPI is a 10-digit, intelligence-free numeric identifier with a check digit in the last position to help detect keying errors. If there is a security breach, the number in itself cannot identify the protected health organization. The use of one identifier with a check digit simplifies the encryption of this number when transmitted electronically, thereby enhancing security. HIPAA also requires that employers have standard national numbers that identify them on standard transactions. The employer identification number issued by the Internal Revenue Service was selected as the identifier for employers. This number is used as a federal tax identification number for the means of identifying any business entity and for the purpose of reporting employment taxes. The EIN should be protected as a social security number is. Both the Information Technology Laboratory and the NICST are involved in the development of technical, physical, administrative, and management standards and guidelines for cost-effective security and privacy of sensitive, unclassified information in federal computer systems. Let's consider about ICD-10 as a coding of diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases, as classified by the World Health Organization. The code set allows more than 14,400 different codes and permits the tracking of many new diagnoses. These codes are 3 to 7 characters in length and 68,000 in total number, whereas ICD-9 diagnosis codes are 3 to 5 digits in length and over 14,000 in number. Now, currently we use ICD-10. These codes. Due to the increased number of codes, the change in the number of characters per code and increased code specificity, this transition will require significant planning, training, and software system upgrades replacement, as well as other investments, as it is considered to change go to the ICD-11 from ICD-10. On January 1, 2012, standards for electronic healthcare transaction changed from version 4010A1 to version 5010. These electronic healthcare transactions include functions such as claims, eligibility, inquiries, and remittance advices. And ICD-10 codes must be used on all HIPAA transactions, including outpatient claims with dates of service and inpatient claims with dates of discharge on and after October 1, 2015. It was changed from ICD-9 to ICD-10, and currently we should move to ICD-11. Let's here you see the example of code. And during the 72nd World Health Assembly, taking place from 20 to 28 May 2019, the World Health Organization officially adopted the International Classification of Disease 11th revision, ICD-11. The World Health Organization 18th of June 2018 in Geneva released the latest edition 11th of the International Classification of Diseases. And look here what is new in ICD-11. You see here it's fit for a particular purpose, reporting mortality, morbidity, or other users. And new methods, pre-coordination, coordination, and STEAM codes, post-coordination, and sanctioning rules, multiply, parenting, and some other. New and improved tools, coding tools, browsing tools, translation tools, mapping tool, and proposal tool. You see here. International Classification of Diseases, ICD-11. The ICD is a standard disease coding for statistics and information regarding diseases around the world, and it contains 55,000 unique codes for each of the disease conditions and injuries, and also causes of death. These codes are common for healthcare professionals worldwide and provides a common sharing platform for reporting diseases and conditions. This coding system is widely used by health insurers, data collection centers, international health databases, national and international health program managers and planners, etc. Dr. Tedros Adhanom Ghebreyesus, World Health Organization Director General, in his statement said, "The ICD is a product that World Health Organization is truly proud of. It enables us to understand so much about what makes people get sick and die, and to take action to prevent suffering and save lives. For the first time, healthcare workers have also been a part of the meetings and efforts in making the changes. Over 10,000 proposals were received by the World Health Organization (ICD) team for making important changes and revisions to the earliest version. Important additions and improvements have been made over the previous version, taking into consideration many of those proposals. One of the major differences in the latest edition is that it is fully electronic and is more user-friendly. The ICD-11 is set to be presented at the World Health Assembly in May 2019. It will be then adopted by the member states and some come into effect from 1st January 2022. One of the new additions to the ICD-11 is the inclusion of antimicrobial resistance that is vital in therapy today. The codes for resistance of antibiotics are in support of the global antimicrobial resistance surveillance system. There is a separate chapter on traditional medicine and one on sexual health problems. These have been given importance in the new version. There is a section on gaming disorder that is classified as a new addictive disorder. For the first time, healthcare workers have also been a part of the meetings and efforts in making the changes. Dr. Robert Jacob, team leader Classifications Technologies and Standard, World Health Organization, explains, a key principle in this revision was to simplify the coding structure and electronic tooling. This will allow healthcare professionals to more easily and completely record conditions. Gaming disorder, and you see here specific code for gaming disorder. For the first time, World Health Organization is classifying gaming disorder as an addictive behavior disorder. Now we can measure how many people are affected. Another example, the allergy in ICD-11 initiative, and you see here how it works. The most visible outcomes: strengthen awareness of current concepts, health clinical medicine, ensure quality management of allergic patients, support research in the field, and public health outcomes: reliable epidemiological data, morbidity, mortality, decision-making and prevention, appropriate allocation of resources, support allergy specialty. In the ICD-11, trans-related categories have been removed from the chapter on mental and behavioral disorders, which means that trans identities are formally de-psychopathologized in the ICD-11. An effective IT COOP plan must first classify each IT process and resource as it relates to the operations. Is it critical, important, or marginal? Second, an appropriate level of risk needs to be established by the business owners of the practice of facility based on the business impact of a failure to a system or process. There are systems for which any interruption would represent a significant loss. A disruption on activity to any type of network event can have a real impact on operations to include compromised patient information, lack of confidence in the IT system, and decreased revenue through the loss of patient trust and subsequent loss of patients and/or cost associated with the security consultation. Because no set of prevention measures is perfect, it is necessary to both detect security breaches and take actions to reduce their impact. The first step is to evaluate the existing environment and identify where the organization is at risk. This includes a thorough assessment of current systems and data, and performing checks such as real-time intrusion testing, validation of data, audit trails, firewall testing, and remediation when gaps or failed systems are exposed. This involved with overseeing security should have a working knowledge of federal regulations and of the following security mechanisms: vulnerability assessment, security policy, procedure and plan development, and/or assessment of the existing plan, risk management, assessment of environmental factors, firewall, router, especially a filtering router that examines the IP address and header information in every packet coming into the network, and server assessment. Security application assessment, incident response and recovery assessment, authentication and authorization systems, security products, firewall implementation, A means of the first line of defense, public key infrastructure design, virtual private network design and implementation, intrusion detection system, penetration testing and information sensitivity assessment, security awareness training and compliance program. Evaluation of system architecture and components, documented system inventory, list of threats with severity of impact, list of safeguards for controlling, level of residual risk that would remain after recommended changes are made, development and/or assessment of disaster recovery plan, storage and archiving of health information, developing and implementing data access control procedures, sign or amend contracts with business associated to protect the confidentiality of protected patient data exchanges conducted electronically, implementing technical mechanisms to prevent unauthorized access, establishing a reporting and response system for confidentiality violations. Decision tree is used here, determining alternative disaster risk sites. And here you see decision tree for this. Next is developing a sanctions policy for the discipline of violations by employees, agents, and contractors. An audit trail record all related to a single person, account, or entity. Assessment of virus checking software. Contingency plan must be developed and tested to determine their effectiveness. All risks or vulnerabilities addressed need to be prioritized with action plans to mitigate the risk. Evaluation of information security and DR plans is an ongoing process of discovering, correcting, and preventing security problems. Business continuity planning. It is vitally important that IT security mechanisms, policies, and procedures address the continuity of healthcare business functions. System access control. This requires that the system should tell how much information each user can access using minimal PHI as required by an employee's job description. The access control mechanism can be user-centric, based on credentials or access rights associated with a user, or resource-centric, based on access control lists that detail the access rights of various users on a particular information resource, or role-based access associated with groups of individuals. System development and maintenance. Clinical systems, application systems, system files, and development and support processes all have security requirements as well as a need for cryptographic control. All operational systems must have security safeguards to minimize loss, modification, or misuse of user data in application systems. This includes regular backups, verifying data security in each record. Physical and environmental security. Access to clinical workstations and mobile devices should be controlled so the access is available only to authorized personnel. Compliance. This involves legal requirements, security policy, technical compliance, and system audit considerations. All of the ISO requirements can be downloaded from the ISO site. Personal security. The greatest harm, disruption to a clinical system comes from the actions of individuals, both intentional and unintentional. Several personal security measures should be considered. Review all positions for sensitivity level and state whether individuals have received the background screening appropriate for the position to which they are assigned. Some other principles, like critical functions, need to be divided among different individuals to ensure that no individual has all the necessary authority or information that could result in fraudulent activity. Establish a process for requesting, establishing, issuing, and closing user accounts, and establish termination procedures. Security organization. A management framework for information security and for access by third parties should be established and controlled. Communication and operations management. To ensure a secure operating environment, the IT staff should utilize a help desk for support and troubleshooting to replicate the IT physical architecture as a mirror to the existing server in case the system goes down. All technology assets need to receive an appropriate level of protection and using some security policies. Let's move to the questions to the lecture. The first question is, what are the benefits of market competition in healthcare? Question 2. What are the barriers to free market competition in healthcare delivery? And question 3. What reasons have resulted that healthcare services have experienced significantly lower productivity growth rates than other industry sectors? Thank you for your attention.